Hello, and a welcome everyone. Thanks for joining us from where you are turning in today for the future of nursing, technology, leadership, and the future of care. I'm Sakshi Pandita. On behalf of Academy of Digital Health Sciences, I welcome you all to this live discussion, which is also accredited by the Indian Nursing Council with 2.5 CNE hours and zero point 0.5 CNE credits. And this will also be streamed live through our Health Parliament page, which has over 31,800 active participants. The Academy of Digital Health Sciences is a strategic business unit of Digital Health Associates dedicated to capacity building of healthcare professionals. We offer world self-paced courses on digital health, specifically designed for clinicians, nurses, paramedics, and other healthcare professionals. Nurses form the absolute backbone of healthcare worldwide, making up nearly 50% of the worldwide health workforce and delivering over 80% of hands-on patient care. Yet, health systems are navigating an urgent deficit of roughly 4.5 million nurses, made worse by severe administrative friction, where clinicians spend 25% to 40% of their shifts completing documentation rather than directly caring for patients. While emerging technologies like ambient AI and remote monitoring promise relief, real transformation happens only when nurses move from passive software users to the active leaders and designers of digital health. Today, we gather global nursing leaders to explore how we bridge this gap between digital innovation, clinical leadership, and human centered care. It is truly encouraging to see the response this discussion has received. The last time I checked, we had crossed around 4,171 registrations, making this one of the largest live conversations on the future of nursing. Thank you for all being here. It is a live interactive discussion conceived with a simple objective to bring together global nursing leadership to discuss where the profession is headed and what every nurse must do to remain future ready. Healthcare is changing rapidly, and so is patient expectations, workforce challenges, and new models of care. Rather than discussing these challenges in isolation, Dr. Rajendra Pratap Gupta felt it was important that nurses hear directly from those who are changing the future of nursing across the world. Today's discussion has therefore been designed as a conversation, one that encourages learning, reflection, and interaction with global leaders. Over the next hour and a half, we will explore not only how technology is changing nurses, but how also leadership, education, and innovation will define the next generation of nursing professionals. To set the stage for today's discussion, it is my privilege to introduce the ideator of this session and our moderator for today, Dr. Rajendra Pratap Gupta, Chairman of Academy of Digital Health Sciences. Dr. Gupta is a leading global voice with decades of experience shaping policy across various sectors. In May 2026, the United Nations Secretary General nominated him on the Multi-Stakeholder Advisory Group of the Internet Governance Forum, a UN body. He also co-chairs two important committees at the United Nations Internet Governance Forum, Policy Network on Artificial Intelligence and the Working Group on Strategy. He played a crucial role in drafting the National Health Policy 2017, National Education Policy 2020, ideating Viksit Bharat, and other national policies. He served as an advisor to the Union Health Minister, Government of India from 2016 to 2018. He's also a former member of the global roster of experts of digital health and member of Guidelines of Development Group at the World Health Organization. He has been the rare distinction of leading three dynamic coalitions at the United Nations Internet Governance Forum, namely Digital Economy, Environment, and Digital Health, and also the chairman of the Commonwealth AI Consortium Capacity Building. He is the architect of the Functional AI Pyramid Model, the AI Maturity Model Framework. And joining him are distinguished nursing leaders whose work continues to shape the profession across the globe. It is my honor to welcome our esteemed panelist, Dr. T. Dilip Kumar, President of the Indian Nursing Council, board member of ICN, and former nursing advisor to the Government of India. He worked as an ex-project director, GFATM program, and ex-nursing advisor to the Government of India. He is having long-standing 43 years of experience in nursing. He has also worked in different capacity, starting from staff nurse, nursing tutor, nursing superintendent, deputy nursing advisor, and nursing advisor to Government of India. He was member of Global Advisory Group on Nursing and Midwifery of WHO. And he was the first Indian professional, nursing professional from India to become the member of the Global Advisory Committee of WHO. Next up, we have Dr. Jose Luis Cobos Serrano, President of the International Council of Nurses. He is a global health leader whose work has made a significant impact on the advancement of nursing, both nationally and internationally. A steadfast advocate for professional excellence and evidence based care, he currently serves as the 30th president of the International Council of Nurses for the 2025 to 2029 term. At the national level, Dr. Cobos has held the role of third vice president of the Journal Council of Nursing of Spain since 2021, also contributing to the strategic direction and professional development of nursing in that country. He has been a member of the Council's plenary since 2017 and formerly served as its deputy secretary general from 2019 to 2021. We have with us Dr. Tereshti, Vice Chair, Department of Nursing Transformation at Mayo Clinic. She's an assistant professor of nursing at Mayo Clinic at College of Medicine and Science and serves as a vice chair nursing for Mayo Clinic, leading the enterprise department of nursing transformation work. She is the creator of My Story, a tool to capture each hospitalized patient's story to personalize their care. In her current role, Dr. Tirishti and the enterprise practice transformation team are leveraging AI to build transformative tools for nurses by nurses, such as a new nurse virtual assistant tool, Ambed nursing documentation tool, a curated digital transformation for Mayo Clinic nurses, and more. Next up, we have Dr. Peter Preziosi, President and CEO of True Merit, also President of Conference of NGOs in Consultative Relationship with the United Nations. As President and CEO of True Merit, the world's largest credentials evaluation organization of the nursing and allied healthcare professionals, he's working to revitalize its leadership in developing and implementing credentiality solutions for a globalization health workforce. Prior to joining True Merit, Dr. Preziosi led quality, standards development, and credentialing at the World Health Organization's initiative to build a technology-driven global learning center, the WHO Academy, with a goal of upskilling millions of health workers worldwide. And we also have on our panel today Ms. Rebecca Love, CEO and co-founder of Nurse Approved. Ms. Rebecca is an esteemed nurse executive, renowned speaker, and a prominent figure in the nursing profession. She is a regular contributor on the Forbes Business Council and has been featured in BBC, Fortune, Becker's, Forbes, and STAT Chief Healthcare Executive Magazine and ABC News. She made history as the first nurse to be featured on TED.com and is recognized as one of LinkedIn's top voices and was nominated as one of modern healthcare most influential people in healthcare. With a pioneering spirit, she has served as inaugural director of nurse innovation and entrepreneurship at Northeastern School of Nursing in the United States. Her groundbreaking initiative empowered nurses to embrace their role as innovators and entrepreneurs, leading to transformative change within the nursing profession. I welcome you all and thank you so much for your time. Now I'll hand over the discussion to Dr. Gupta. I'll invite you to open this discussion and take it forward.
Thank you, Sakshi Shomat, and I thank all my expert panelists. I couldn't have asked for a better panel in this world. I think these are the leaders who are shaping the future of nursing and future of healthcare together. So also all those who joined, and I see that we have hit the upper limit of 500, though we have been talking to Zoom to up it, but I think we have not been successful. So Sakshi, I think we have over 4,000 registration. If you can send message to all of them to join us live on Health Parliament, that will be good.
Yes,
Every time, this is a very good experience with nursing. And I must state that when a few years ago, I went to Dr. Dilip and said, we should do something for nurses, bring them mainstream for digital health. He said, Rajan, what do you need? And there started our global summit on nursing and digital health. Dr. Jose came in last year as our chief guest, and he inspired nurses from across South Asia region. And it has become a continuous experience for us. If we do anything for nursing, we take one step, they take 11. And this is today again proven. We never factored that, registrations would cross more than 2,000. 2,000 is what we expected. But when we cross 4,000, and it's a short notice. I always believe with this that though half of the world's health workforce is nurses, but the power to healthcare is more than 90% coming from nursing. And every time they're so passionate despite being overworked, it every time makes me commit more resources to nursing than ever before. I have never been disappointed by nurses, at least I can say. For rest, I have no comments. Everyone is very enthusiastic about healthcare transformation, but nursing and this kind of leadership that we have today is mind-blowing. So let's start, and I'll tell you our idea was we need to shape the future. And for years, I've been a part of it. So I thank all nurses from across the world for saving millions of lives during COVID. not just at the front lines, but at the healthcare delivery. No one was closest to patient than you are. No one is closer to patient than you are. No one is closer to transformation than you are. You are the real healthcare delivery. You are the real leaders. And I would now share about what work we have been doing as our commitment to nurses. Next, please. Yeah, next slide. So, way back more than 5 years ago, we started doing studies on nursing. We're surprised the kind of conditions they work in. This was India specific. But then we got, little alarm that we need to do more. So within India, we were lucky to have Dr. Dilip as our true inspiration and a mover and shaker who has moved things pretty fast. So we saw this study, then we move again. And as this year, we do the largest study on nursing ever done here. Next, please. So this is a multi-stakeholder study we have done, and you can see the findings that we have with us. And this would, by and large, be kind of a global scenario on terms of the time spent and the shift on direct patient care. While look at 75% of their time on direct patient care is like one third of nurses they do. That's huge. And 39% spend more than 50 less than about almost 50%. The other one is 23.4% report managing more than 30 patients per shift in general wards, and 44.7% spend more than 50% of their shift on documentation and 42.8% administrative tasks. This is a primary study. We have also captured doctors, hospital CEOs in this study. Next, please. This is the state of world's nursing report, and we are just picking up some of the portion on ICN. We have the president of ICN here. So we're just picking up 3 chapters and what is the message that the zone report has. Next, please. So one of the highlights in this report is on nursing education as a strategic direction, on leadership, on the proportion and the authority of nurses in senior health and academic positions, and continuously develop the next generation of nursing and midwifery leaders. One of our goals as what we do and why we engage with leaders like you is to focus on education, leadership. We believe that it will be more humane leadership in healthcare if nurses get those leadership roles like you are today. Next, please. So next is, of course, the digital learning skills. We know, I keep saying that if you're not into digital health, you're not into healthcare because that's the operating system of healthcare. If nurses don't master this skill, healthcare will never be able to leverage the full potential of digital health. So that's something that we saw on the zone report, and we wanted to highlight that even in today's conversation as a context setting before we get on to have individual conversations with leaders like you. Next, please. So you can always join the health parliament. You can go to the app, download. There's a complete forum that we built in 5 years back on the future of nursing. That's what our vision and commitment to nursing is. You can look at the future of nursing professional discussion forum, which has been there since 2021. Our whole idea has been let's create that future. Next, please. You can of course download that, but that's not the main goal here. Let's move to the discussions now. And I will go first to my panelist, Dr. T. Dilip Kumar. Dr. Dilip Kumar, I have the rare fortune of working with you, a man of action. I want to hear your thoughts on this important topic that we are discussing here and the work that you have done to show how regulators change nursing in a country or a region. Over to you.
Greetings from the Indian Nursing Council to all my panelists, distinguished global leaders, organizers, esteemed panelists, and colleagues joining us from across the world. Good day to everyone. I extend my sincere gratitude to the Academy of Digital Health Sciences for convening this live session. It is amazing to share this platform with such an accomplished panel, and I understand we're about now 4,500 people have registered from across the world. I am since I am the working with the regulator, and my primary responsibility to improve the standard of nursing education. As I see myself in this profession for now over 50 years, I witnessed how medicine has transformed. The speed and direction of change has been phenomenal. As President of the Indian Nursing Council, my mission remains grounded in fundamental truth to build a healthcare system that truly revolves around the patient. We must put across the nurses at the absolute center of innovation, technology, and leadership are the two forces making that possible. I think just now Dr. Gupta has shared about the zone report. In that, mainly 4 themes have been identified in the zone report, which are very relevant to India, and also it is a music to ears since I worked as a policymaker for in the Ministry of Health and Family Welfare. These 4 issues which have been flagged, the themes which have been flagged for the zone report is very, very appropriate. And especially in this today's context, today's topic of leadership, I think one of the out of the 4 themes, the first theme is investment, which is very badly required by the various agencies, starting from the government to the private sector. I think more investment is required. And the creation of the leadership is the second theme, which is very, I think there is a need to create the positions on the basis of the optimum nurse-patient ratio, which has been accepted by the different policymakers. And the third is very important to this today's discussion, the leadership. I think the evidence has been captured in the zone report. If the nurses are working with the various professionals, and if their leadership skills are given to the nurses, the impact and outcome for the patients are going to be very effective. So therefore, at least the Indian Nursing Council has brought the branded ICN Leadership for Change program to India. We have trained about 40 people. I think they are going to take further to train more people how best we can in the clinical setting can make an impact and outcome for the patient outcomes. Similarly, the technology, I think we have started the simulation as one of the method of teaching in the nursing education. We have brought the state-of-the-art simulation center in Delhi, and which has many of the recently the Italian delegation, the ambassadors and embassy people, and also the nursing leaders from the Italy visited our simulation center, which has they've been appreciated. This is one of the state-of-the-art simulation center. The similar one we have established in down south in India. So 2 simulation centers. Now the capacity building of the existing faculty to improve the nursing education, quality of the nursing education. And we have trained about 1,600 faculty people. Every month, Indian Nursing Council is investing money for the capacity building for the travel and stay in Delhi. We have trained about 1,600 faculty. We want to see how impact and outcome is going to improve in the quality of the nursing education. The Indian Nursing Council also has the responsibility of creating an awareness about digital health, and we partnered with the first ever dedicated global summit on digital health, specifically for the nurses in 2024. I was so much thrilled to see the response from the nursing professionals. About 600 people attended, and our president last digital health meet, which was held in Mumbai, he was able to witness the digital health summit, how the nurses were active in that digital health summit. So nurses are really want to get into the digital health so that they can provide a qualitative nursing services in the clinical and also in the community. And the hands-on digital health training to nurses is very important. We proved that when nurses master digital tools, the clinical outcomes are going to improve across the board. This is now an annual summit, and this year I am the co-chair. So we hosted co-host last year at the Global Digital Health Summit. Then we moved on to upskilling to make world-class education available at scale of the nurses. Our strategic partnership with the Academy of Digital Health Sciences have been pivotal. Together with them and the Indian Institute of Management, Raipur, which is one of the state-of-the-art management institutions, we introduced the professional development program in digital health for nurses and midwives. Designed with a global faculty, this global curriculum delivers insights relevant to the healthcare system anywhere in the world. One of our priorities was to ensure that cost should never become a barrier for the learning. Therefore, We worked closely with the academy to make this program available to nurses and midwives at highly subsidized fees, enabling greater participation from across the world. Continuing this momentum, we have introduced the Certified Digital Diabetes Nursing Educator Program with the Academy of Digital Health Sciences, a pioneering course equipping nurses and midwives with digital tools to tackle chronic disease management with high clinical precision. And today, we are proud to announce our next major milestone, the official launch of the Professional Development Program in Artificial Intelligence for Nurses and Midwives, offered by Academy of Digital Health Sciences. Nurses and midwives from across the world can take this course on artificial intelligence. I'm very happy. Only today morning, we had an executive committee of the Indian Nursing Council. All our executive members have appreciated this is the need of the hour, and also we have one of the executive member in our Indian Nursing Council is representing the Indian Medical Association, which is one of the largest professional medical community. And he was so impressed that this is a need and it should be taken forward. And also is going to talk with the Dr. Gupta ji to take forward this message to the medical fraternity also. This specialized program will demystify artificial intelligence for a bedside and community practice. Artificial intelligence is not designed to replace the compassionate human touch at the heart of the nursing. It exists to reduce administrative burden, enhance diagnostic accuracy, and streamline clinical workflows. Our mission is clear, not just to teach nurses and midwives on how to adopt technology, we are training them to lead digital transformation across health systems worldwide. Over the years, we have also worked to strengthen the role of the nurse practitioners in India. Through sustained efforts, we have been able to promote advanced nursing education and successfully obtain the necessary government approvals to establish and strengthen the important role within our healthcare system. This reflects our larger vision of creating expanded career pathways and leadership opportunities for the nurses and midwives in India. Ultimately, every initiative that we undertake has one common objective to improve the quality of the patient care. When we invest in nurses, we invest in better healthcare outcomes. By equipping nurses with the right knowledge, digital competencies, and leadership skills, we can build a healthcare system that is truly patient centric, efficient, and future ready. In addition to these efforts, I have also been serving as a commissioner on the Global Commission on Healthcare for the 21st Century initiative by the Health Parliament, where we are actively working to shape global policies for building an intelligent, equitable, and sustainable health workforce. Our work, however, is far from over. Looking ahead, my commitment is to ensure that nurses are never left behind as the technology advances. I once again congratulate the Academy of Digital Health Sciences for organizing this timely discussion and thank all the distinguished panelists for sharing their valuable insights. I am confident that today's deliberation will inspire many more nurses to embrace lifelong learning and become active leaders in shaping the future of healthcare. Let us remember, we spend the maximum time with the patient. We must make the maximum impact and be the first to adopt these latest technologies for nursing and healthcare transformation. Thank you very much.
Thank you, Dr. Dilip. And it is so inspiring as a regulator that you have taken over the stewardship for creating awareness, education, upskilling, and also setting a vision for nursing in general, representing more than 10% of the world's nurses as Indian nurses are over 3 million plus out of 30 million. I think this is a great role to play given that Indian nurses are all over the world. It is so good to hear that there are leaders like you, and the role of regulators is also getting defined in what you said. Now I move to Dr. Jose. Personally, I have benefited out of hearing him, working with him, seeing his commitment. Every time there is something for nurses, he will take out time and be, whether it is Geneva, New York, Delhi. Thank you so much, Dr. Jose, for committed to nursing as much I think others are. But at your position, I know what it means to take out time, travel all the way, and inspire people. I think we are blessed to have you. So with this, I want you to share your global perspective on the trends shaping the nursing profession, how healthcare systems around the world are preparing nurses for the future, and drawing on the work of ICN, discuss the evolving role of nurses, emerging global priorities in nursing education and practice, and the competencies required to enable nurses to thrive in an increasingly digital AI-enabled patient-centered healthcare system? Sorry for a very loaded question, but you have your time to answer it. Thank you.
Okay, thank you. Thank you very much, Dr. Rajendra, and every panelist. It's an honor and it's a pleasure for me to be here in this panel discussion. I think it's a very good opportunity to share a lot of experiences around the world. But first of all, I think it's very important to analyze what is the situation and what is our future with all of the changes around the world. It's a very, very huge moment for all of us, all of the health professionals, not only nurses, but again, we have to remember nurses are the biggest number of the health professional in all health systems. So first of all, everybody have to understand we have an opportunity to use this power of the nurses around the world and this capacity. So for me, it's important to talk about the actions, because sometimes we talk a lot, we have a lot of reports, we have a lot of documents, and I think the analysis is very clear. The analysis is now knowledge by all of the health systems and the authorities. But what is the power of the nurses around the world to change the health systems and the reality now with the next century or next years? I think one thought that I have when I choose, for example, my watchword in my mandate is empowerment. When I thought, what is the capacity that we have as a nurse in the health system? But first of all nurses have to believe on their capacity, because if not, we can change a lot of things, we can improve a lot of things, but they can use it. We can introduce the digitalization, the AI, all tools that we have, but how they can use it if they don't believe on that. I think the capacity of the nurses is very high level around the world. And the challenges is very clear for the elder people, new illness, the pandemics, for example. We have some example with the COVID pandemic, the climate change, all things that are now on the table is possible to cover with the nurses. But we have to use it, and we have to capacity use this capacity and the competencies from nurses. So we have to implement more ongoing training and how we can use this technology in the future, because younger people now burn with this technology, but most of the nurses around the world haven't the opportunity to learn in the university how to use this technology in the reality, in the daily. So ongoing training, and as Dr. Dilip said, some experiences in India, we introduced the courses or all opportunities to provide this technology for the nurses. In ICN, we have now this opportunity to introduce a new learning hub with, this is the project, Learning Hub. It's an space in the website. We produce all courses, all ongoing training that is necessary to provide all nurses, because I understand, and my organization understand, not everybody have the opportunity. It's in each country at the same level. Sometimes we have a lot of differences. So the empowerment is in 3 lines the empowerment of the organizations, the empowerment of the NNAs, for example. Dr. Dilip said some example of the international India Council. What is the things that we can provide to all nurses around the world? This is one of the challenges that we have for the future. And the other thing is, what is the leadership of our nurses in each country? What is the relationship with the governments and the responsibles and the directors of the health systems? They have the opportunity to sit down in the same table, doctors, nurses, technologists, all technicians, all people that interview in the have the capacity to decide all things in the health systems. Our voice is in front of this high level in the institution, WHO, ILO, all institutions have to listen, not hear, listen the nurses' voices, because we have the experiences, we have the contact with the patient in the daily. So we have the opportunity to provide what is the solutions that we have to provide in the health systems. It's not theoretical, it's action directly with the relationship with the patient. So this is a very good capacity that we have. When we said, and with the government said, oh, nurses is the backbone in the health system. Yeah, but sometimes it's worse. It's not the action and to provide the opinion from the nurses. So it's very important to have leaders as a nurse in the health systems. Of course, they have to believe in their capacity as a leader, because sometimes we want to be in contact with the patient, but not it's our job to be at the political level and as a politician and in the government, in the parliament. So I think it's a challenge for us as professionals. And finally, I think with all of challenges that we have with the new technology, the AI and all things that are now developing, I think we have a very important challenge at the ethical level, because we have to use very well this technology. It's not to supply professionals, it's not to stop the contact between the professional and the patient and the families, all people that we can provide care. I think it's an opportunity to use, for example, to use very well the time, to use very well the information, to have very quick answer for some problems, but not to supply. And not at the ethical level, of course, is an important thing, how we can share this information around the world, but protect the confidentiality of the patient and the people. So this is the challenges that we have for the future, and this is our global vision, that it is an opportunity, and we have to talk as positive level. It's not a negative moment to provide. We have a lot of problems. We are having enough professionals. I think it's an opportunity to talk in a positive light and to provide what is our vision, what is our challenges as professionals and as a nurse, and of course, as a leader of the health systems. Thank you.
Thank you, Dr. Jose. I think very important point you start with, which is believe in your abilities, your capacity. I think that self-belief is very important if we want to move forward. That's the inner strength. And I think we cannot underscore the importance of ongoing training, nursing leadership, And we have to listen to nurses, not just hear them. That's a very important point for us to remember. And what you end with is a very important message. It's a great professional opportunity, but ethical responsibility of how you use technology. And I think that's a fundamental message to anyone today adopting technology. Because technologies will have a way of vendorization, as I call it, of to push every technology made as good for health, good for professionals. But that is when you understand technology in at least the depth that you should know as professionals, you can make an ethical judgment whether I will use it or not, because with it comes privacy, security, confidentiality, and of course, many other things. Very interesting. And now I move to Dr. Cherishti. Dr. Cherishti, you've been at the helm of nursing transformation. And I've been inspired to hear you in person in Scottsdale, given our association with Mayo Clinic. And I would want to understand, what does nursing transformation mean to you when you look back in context of last 5 years versus next 1 year? The world has changed in an unimaginable way. And who better than you could tell us what nursing transformation is going to be about?
Thank you. Hello to everyone. Thank you for the opportunity. I'm just really grateful to be part of this conversation. It's an important conversation in our time today. Grateful to be part of this panel of esteemed panelists, and some really great messages already. Dr. Kumar and Dr. Jose, both the work you're doing and your call to action is inspiring, and it's hitting right at the right time. I think your question is a good one, asking us to look back in reflection on the last 5 years and to look forward and to say, how is this transformation, how is this moment in time affecting us as professionals, as nurses, practicing nursing, and how is this impacting patients and outcomes and the experience patients are having throughout our care system across the globe? I think it's sometimes hard as we reflect individually to think of how that connects to the larger, because as you've noted, Dr. Jose, where we each are and where the systems that we're each working in, those might look a little different. But I would challenge us to say that over the past 5 years, there are some things that are very much the same that we're probably all experiencing within healthcare as either consumers or healthcare providers, nurses, professionals. And those things I think are the increasing amount of complexity, both in the ecosystems and the systems and the care models that we're working in, but also in the patients and the families and the communities and the needs that we're being presented with and that we're working with and shaping care for and around. So I think the nursing profession for sure is experiencing one of the most significant transformations in history right now today. And as healthcare becomes increasingly more digital, the future of nursing is not defined simply by adoption of new technologies or the new technologies that are emerging right in front of us or around us, but instead by the evolution of the nurse's role in a more connected and intelligent, patient-centered ecosystem. So historically, 5 years and even longer back than that, nurses have served as the coordinators of care, the translators of information, and the trusted partners for patients and families. And I think as we look forward into the future, those responsibilities remain unchanged. What is changing, however, is how nurses are going to be enabled to fulfill these roles. If we do this well and if we do this right, technologies such as artificial intelligence, ambient documentation, digital assistants, mobile platforms, predictive analytics, and agent-based workflows will begin to reduce administrative burden, automate routine tasks that don't require the heart or the head of an RN, and create opportunities for nurses to spend more time doing their highest value work and the work that really depends on that human connection, that human judgment, empathy, and relationship building with patients, families, and communities at large. So the profession is really shifting from a model that's centered on task execution. And maybe this model is one that we didn't develop ourselves as nurses, but really maybe one that we inherited. And all along the way, with each new emerging thing, whether that was a model of care or a technology or the introduction of an electronic health record, somehow things brought us to task execution and information gatherers or documenters within those information systems. and one that was maybe less focused on that clinical judgment, and maybe not less focused, but maybe less time to do the clinical judgment, the relationship-based care, and the complex decision-making that nurses are positioned best to do. And we know that these are the things that impact the care experience of patients and patient outcomes. So I think technology will enable nurses to move from being managers of information and interpreters of information to orchestrators of care. And I think this is really, really exciting time to have technology that supports care delivery models and positions nurses to spend more time with patients, less time searching, documenting, and navigating systems, more time synthesizing insights, coaching patients, and leading interdisciplinary teams and leading the care for patients. This is going to create new outcomes for patients and families, unmatched care experiences for patients, but for nurses as well. At the same time, I think the profession itself of nursing is becoming more influential in shaping healthcare and innovation. Increasingly, nurses are no longer passive recipients who are handed technology to begin using in their care setting or to implement. They're stepping more into roles as inventors, designers, builders, strategic partners in the development of digital solutions. And this is important and it's really, really good. The most successful innovations are those that are developed with nurses, not for them. This shift really recognizes that nurses possess a unique understanding of patient needs, the workflow realities, and the care delivery challenges that really can't be replicated elsewhere. And we heard that earlier in the panel, that nurses are at the fingertips of where the care is being provided. And that gives us a unique experience to define and design the new solutions that are needed to get new outcomes. So maybe one of the most importantly, the profession is transitioning from implementing change to leading the transformation. And we heard from Dr. Jose the call to action to really step in and own that role that we can play as nurses. Nurses are increasingly positioned to influence organizational strategy, redesign care models, shape technology roadmaps, and drive system-wide innovation. The question is no longer whether technology will change healthcare. The question is whether nurses will shape the future and how we will shape the future. I believe that organizations that thrive will be those that empower nurses as pioneers, not as passengers, and that they are the pioneers of the digital transformation of healthcare. So the most important question facing us now is not whether AI will change nursing, but more importantly, how nurses will shape the AI, the digital health, and the future of care. We have a real opportunity right now to truly transform how care is delivered and experienced for both nurses and patients. And when I think about this, and when we think about this at Mayo Clinic, we really think of a framework to help us be prepared to have knowledge from the past 5 years as we're moving into and through the next year and beyond. And that framework that we've really been focused on is around knowledge. What's the knowledge we need to equip our nurses with to be able to do this and do this well? Skills. What is the skill set? Where is the opportunity to practice? How do we go from being an expert back to being a novice in a new world or a new model? Where do we get to practice that with patients and maybe before we're with patients as well? And what is the shift in mindset? What is the mindset that we have to be true leaders of transformation as we shift this culture to a new future? So really quickly, I can give just a few things in each of those categories before I hand it back. As I think about knowledge and what nurses need to know and understand, we know that there's a need to have some digital health, AI, and technology literacy. Now, we also know this doesn't mean that nurses need to become technologists. They need to know enough to be good partners to technologists. They need to be able to identify the opportunities. Where is the opportunity and the challenge or the problem that we can leverage AI or new tools, digital systems to help solve for? And then partner with technologists to help build that solution, testing it all along the way and building it within the workflow, not outside of the workflow. So it's not technology layered on top of a problem or opportunity, but technology that's built based on the problem or an opportunity and based within the workflow where the nurses and the patients are. So they don't need to become software engineers, but they need to know how to partner well with those folks and ask the right questions and evaluate the tools effectively. Second, healthcare systems and transformation. As healthcare becomes increasingly more complex, nurses need to understand how care is designed, delivered, and improved across the continuum, not just in their individual units or areas of focus or domains. So future-ready nurses should understand healthcare operations, quality improvement, implementation science, systems thinking, how what we're doing in one unit might affect other units around them or across the longitudinal care system, and how technology, research, and strategy intersect to improve care and build this transformation in front of us. Then in the skill bucket, as I think about skills and what nurses need to be able to do, I think about evaluation and use of technology and doing that critically. So we have to know and have the skill set to be able to use the technology. The goal is not simply technology adoption, it's thoughtful use and evaluation. Nurses need to be able to assess whether technology improves patient care, improves the workflow, safety, clinical outcomes, while recognizing where human judgment remains essential and cannot be replaced or cannot go away. Future-ready nurses should be able to evaluate AI, digital tools critically, interpret data and translate insights into practice, integrate technology into clinical workflows, and identify technology risks and limitations, and participate in governance and responsible implementation plans. They need to lead change and innovation. Healthcare transformation requires nurses who can move beyond reacting to the change or adopting the change and instead help shape that change. So the essential skills for this include systems thinking, change leadership, strategic planning, project and program management, process redesign and evaluation, quality improvement, implementation science, and cross-functional collaboration. And finally, we need to have the skills as nurses to co-design solutions. The most successful innovations occur when nurses help define the problem, really understand the problem, articulate the problem, design the new workflow, test the solutions, and evaluate outcomes appropriately. Nurses bringing perspectives on patient care and clinical workflows that technology teams cannot have without the nurse working alongside them. And lastly, as I think about mindset, this is how nurses need to think and lead differently as we look to this future year and even beyond that. Human-centered care in a digital world is the first. So as AI becomes more capable, the uniquely human aspects of nursing become even more valuable. Technology should really augment us as nurses. It will never replace us. Clinical judgment, empathy, trust, communication, ethical reasoning, and therapeutic relationships are what nurses bring to the bedside and to patient care. We have to have a mindset of continuous learning and adaptability. The most important capability being adaptability. The pace of technology change means learning a lot, and it can't end with an initial orientation, initial skill building, or a single degree or certification. Nurses must continue to learn and understand professional practice and the learnings that go along with that in this evolving world. This includes being very curious about emerging technologies, having a willingness to experiment and improve, to challenge the status quo or challenge some of those things that we inherited in the system that we've been working in or the system of the past. It includes innovative fellowships, leadership development, and interdisciplinary learning with our colleagues across the care team and the healthcare system as well. And finally, from technology users to technology shapers, designers, builders. We've moved beyond awareness as a goal, and awareness does not change practice. Building capability does. Having a mindset to continuously build capabilities and skills for what's needed for the future and the future ready nurse is what we need to be committed to. We need to let go of compliance and move towards commitment to where we're going in this new digitally enabled world and future. So in closing, I often tell leaders that the future of nursing will not be determined by how quickly we adopt technology, but rather it will be determined how intentionally we develop nurses. The future-ready nurse will be digitally fluent, strategically minded, innovation-oriented, and deeply human. They will understand how to leverage AI and digital health while maintaining the compassion, judgment, and connection that define our profession. They will move comfortably between the bedside and the boardroom, the multiple simultaneous data sources, and the innovation lab as we lead into this new future. Most importantly, they will not simply adapt to a future of healthcare, but they will create it. The future nurse is one who knows to harness technology to amplify clinical expertise, strengthen human connection, and transform care for patients, families, and communities across the globe.
Thank you, Charity. I think I'm just trying to get, some of the, but it's so inspiring to hear your clarity of how you see nursing transformation. At the very beginning, you put about the increasing ecosystem complexity that we are aware about as things move, as we move to value-based care, the thing that's been happening. And it's not just about technology, but the evolving role in healthcare delivery. That's the essence of how the role transitions. And we have to focus on the human connection, which is very important. I think one of my roles as co-chair of the Policy Network on AI, one of the things we are working is governance, the human-centric AI. I think is very important. Not replacing human judgment. Technology has been enable them to be orchestrators of care. That essence of what nurses would be to healthcare and to patients is absolutely clear with that line. And I think, as you say, where everyone I talk to in the world, they're developing new models. But your point about no meaningful innovations can happen without nursing being involved is the essence of where healthcare will go, with whom or without whom. That's where we are. And I think your framework is very well articulated of what nurses should be doing. And the systems thinking, I would put it like large canvas thinking, which is something that nurses will have to look up, and also innovation and design thinking to make sure that they are doing the role of orchestrators of care as is expected. And I think the point of collaboration for co-creation is the essence of what the new role looks like. So exciting. And I'm sure nurses have got the success formula from your discussion. And I move to my friend Peter Preziosi. Peter is a multitasker. I don't know how he manages, but so much to learn from you, Peter. I would want to hear your views next.
Well, thank you very much, Rajendra, and what an honor. It's really exciting to be on this panel and to hear from thought leaders and really what you're doing out in the world. And it's a real special honor to be on a panel for the very first time with Rebecca Love. She has inspired me for so long, and actually, we were on a journey together with one of her inspirations that she created, Sanciel, to represent nurse innovators and scientists and entrepreneurs and leaders. So it's a real honor to be here with you, Rebecca. I can't wait to hear what you're having to say. And interestingly enough, I think we're all saying very similar things. And I'm going to make 3 points to what I'd like to talk about. And for those that may not know, I was one of the global advisors to the State of the World's Nursing Report that was released by the World Health Organization and ICN. It was a real honor to be a part of that. And one of the co-chairs, Howard Catton, the CEO of ICN, did a brilliant job along with the Health Workforce Department at WHO. And we had a dean from the Philippines, Dr. Bonilla, represent as another co-chair of that of the State of the World's Nursing Report. And a lot of what's been talked about today was discussions that we had at our roundtable. There were 25 advisors from around the world, and capacity building is so critically important right now. And I put my hat on with the work that I'm doing at the United Nations alongside of Rajendra. I mean, it's an inspiration to what you're doing around artificial intelligence, technology, and what you're doing to bring thought leadership to the United Nations in this area. It's so critically important. But the challenges that we're seeing around equity and social justice are really, really critically important when countries are turning inward now and they're putting more money into defense and security spending and taking it out of health, education, and social welfare. So there, I have 3 points. The first point that I want to make, and also to remind everybody, my organization that I'm president and CEO of, we are an assessment and evaluation company. So we support migrating health professionals through certification and how we assess them, evaluate their skill competence. So I want to first say that people are moving and nurses must move with them. Population aging, climate change, conflict, war, and economic migration are increasing the movement of populations as well as nurses and other health professionals across borders. Health workforce shortages in one country increasingly affect healthcare access in another. You can't talk about the issues around workforce policy without discussing migration, mobility, and the ethical use of migration in terms of what that will impact on health systems, particularly low and middle resource countries. I believe what we need are trusted global standards. I'm working on a project right now to look at standardized nursing language and nursing terminology. In fact, ICN has the international, it's ICNP, and I'm blocking the name of what the acronym means right now. But it's a terminology along with NANDA International. We have about 13 different taxonomies that represent nursing practice, nursing care, nursing education, and to look at the variability of those taxonomies as we are seeing more and more nurses migrating around the world. We're going to have to look at those global standards, global quality assurance, the ability to have portable credentials to support safe, ethical workforce mobility, critically important. My second point is that technology is advancing fast, but access is not equal. And, my colleagues on this panel have talked about the use of artificial intelligence, digital health, even medical innovations, transforming care. But the benefits are not reaching all countries equally. We have an issue around equity and social justice. Large gaps remain between high, middle, and low resource health and education systems. When I go around the world and I talk to nurses and look at nursing education programs, there are some countries where nurses are educated by physicians. Now, that's not a bad thing, but what we do is very different in many ways than what physicians do. And what's happening in many of those countries is that we're educating nurses to be physician extenders rather than independent clinicians. And that has to evolve given the dynamics that are occurring around changes in population demographics. So our challenge is not only to innovate, but to ensure every nurse has access to the tools, education, and digital skills needed to succeed. And I was so happy to hear what Dr. Dilip is doing with the Indian Nursing Council around AI in nursing. That's absolutely amazing. And my third point, and this will hearken to a lot of what was already stated by the president of ICN and by our transformation expert, Dr. Churisti. The nurse of the future is an independent leader and community innovator. As people are living longer with chronic diseases, health systems must shift from hospital-centered care to community-based prevention and wellness. Tomorrow's nurse will need new skills in leadership, entrepreneurship, digital health, coaching, and care coordination. Nurses must be empowered to practice at the top of their education, lead new models of care, and help people manage their health, not simply treat disease. And I know that Rebecca is going to appreciate this is because this is another one of her inspirations that she has created. Healthcare financing must shift from paying for treatment to rewarding health outcomes, prevention, and nurse-led community care. So I want to close by saying the future of nursing is not just about adopting new technology. It's about building a globally mobile, digitally capable, and entrepreneurial nursing workforce supported by policies and payment systems that invest in prevention, community-based care, and healthier lives for all of us. So thank you very much, Rahendra.
Thank you so much, Peter. And I think you put the very right context when you started that capacity building is critical for equity and social justice. You cannot move. And I think the point which should resonate with all the nurses who are hearing, who will share this, is that people are moving and nurses must move on with them. I think it's a very important point that we are living in a technology age. If we are out of sync with society, we're not going to be, going ahead. And also that a very important point, and I hope, that we remember 2 years back when we gathered on the World Health Assembly where Dr. Tedros has addressed us on 19th May when we launched Digital Health Sans Borders. The point was exactly this. Technology has advanced, science has advanced, but half of the population still doesn't get access to healthcare. So, and I think this is where nurses can play a critical role. Let's be factual about it with technology. And I think you made this very important point that just imagine we are very privileged that we are connecting from different parts of the world and talking, and we understand what our responsibility is and whom we owe it. Half of the world has no access. 10 million die, they become stats every year, which we quote in books. And that has to change. And I think nurses are truly empowered. The way you put it, the future is an independent leader and a community care provider. I think that holds the essence of plugging that divide of not losing 10 million people for treatable illnesses. So I think that's a very powerful message. And this brings us to my colleague. We work together in developing an AI solution with Contrivia, and I've been privileged to work with Rebecca like you have been. And Rebecca, thanks for joining in. And of course, I would want to understand from you, you have been a practitioner and the developer of AI solution as a nurse. As I think Cherishti said, even earlier speaker said, you have to develop solutions with nurses, not for them. So want your views and what's your message to nurses who are joining. And also I would want those who have joined here and on LinkedIn, please post your messages, questions so that we can get them answered. And Sakshi will pull out the messages from LinkedIn and post it here, because we did have a glitch of capping it to 500, but registrations are over 4,000. So I hope people are joined on LinkedIn too. So please start putting your questions here. Thank you. Rebecca, over to you.
Thank you, Rajendra. Peter, thank you so much as well. And Dr. Kimar, Dr. Serrano, Dr. Ricky, it is a pleasure to join you all here today. My name is Rebecca Love, and 2.5 years ago, I knew nothing about AI. And the conversation that happened at that point in time was I was approached by the dean of FSU, Florida State University, asking me to build the first FSU master's program in nursing and AI in the country. And I said to Jing, I know nothing about AI, Jing. I can't do this for you. And she said, Rebecca, you know more about AI than all of those developing AI for nursing knows at this moment. So we dove into building that program. And at the same time, I happened to be recruited to join as the first chief nursing officer of Quadrivia, where Rajendra and I served first as advisors. I had served briefly as an advisor to Hippocratic AI, but had stepped down over concern of a statement of making a $10 an hour nurse. The idea of AI to ever diminish or demoralize or decrease the value of nursing was never at the forefront of what we should be using to establish AI. It should always be used to establish and empower the nursing workforce to do more. Because what you may not be aware of is that there are 29 million nurses worldwide, making nursing the largest profession in the entire world. There are more nurses than there are doctors or all other healthcare professionals. There are more nurses, there are teachers. There are more nurses than there are any other profession. But absent in that space is often our voice to shape the future in which healthcare currently exists. So I dove into AI. I started as the chief nursing officer, moved into the chief clinical officer of an AI company in which the physician and the nursing team reported into me. And I oversaw the building of one of the first clinical AI practicum tools in the United States, as well as other parts of the world. And what I can tell you is I did recently step down over significant ethical and moral concerns over the lack of standard validation, testing, auditing, human in the loop, and reporting and incident structures that currently exist within healthcare AI. And I think this is incredibly important because I don't think nurses know what is coming for them or what is coming for the future of healthcare with regards to AI. I think in the United States, we're seeing some of the fastest development and deployment in the lack of actual regulations that exist. And because of that, we are seeing horrendous moments of time in which our worlds are colliding, in which patient safety should always come first and nursing should always be at the forefront of actually making sure to determine those standards. In the United States, we're seeing for the first time ever that our Center for Medicaid Services is moving to reimburse for AI services in healthcare before they've developed a model to reimburse for nursing in the United States. And what that means for anyone who understands business is nursing is a cost to healthcare centers. We right now are rolled into room and board rates, which means more nurses equal more costs without associated revenue lines. With regards to the proposals that are being put forward to reimburse for AI, it means now that we are pitting potentially two workforces against each other. AI, which can do several of the services that nurses could do, but now will be reimbursed for delivering those services, and nursing will be cut because they have not any kind of form of reimbursement. The Commission for Nurse Reimbursement, now known as the Center for Nursing Value, an organization that I founded 3 years ago, is calling for nurses across the United States to submit comments with regards to the CMS application. Because in a world where AI can be reimbursed, in which the definition has now directly changed significantly, and within conversations that I sat, where most nursing tasks are now being defined as administrative and can be delivered by AI, means that our scope of practice is being redefined to define AI before we've defined our profession. In the terms of what is being predicted in the United States, the reimbursement models are augmentative, assistive, and autonomous delivery of AI can now be reimbursed without human in the loop in all forms and shape. Now, this is remarkably interesting because we actually have no standards for AI in the United States. There is no degree of human testing that needs to be done, no degree of validation, safety, reporting, human in the loop, validating, auditing, or using AI tools to see if they are even safe. And in fact, there have been multiple lawsuits recently filed challenging our largest healthcare systems in the United States for not maintaining safety and quality with regards to implementation of AI tools. In the absence of regulations, we're going to see the rise of lawsuits when patients are harmed and standards are not followed. It would behoove all of us to establish that there should be standards for AI and that we should be adhering to them globally. Because what we have witnessed is loss of control events that are going on that we don't even understand the implications of what that means. It has been quickly said that AI is achieving a level of intelligence that is not something humans can control. And what I have experienced and witnessed highlights my significant concerns over that lack of understanding. And I think we as nurses who have always committed our entire career to protecting patients first are absolutely necessary to keep speaking out on this. In the United States this past year, we saw the largest amount of nursing strikes in recent history. Nurses are taking to the streets protesting AI at levels that we have never before seen because they feel that their voices are absent in the technologies that are being administrative and they have no ability to put back. What we've also found is that although AI cannot be held legally responsible for the decisions that they make, the nurse's license ultimately is the one that is responsible for the outcomes that AI produces. Now, when nurses are absent from being able to shape that AI, we have created a two-tier system that will further diminish the roles and impacts of nursing at the time we most importantly need to elevate them. We are seeing, for the first time ever, nursing layoffs to be replaced by AI agents in the United States. There is a recent lawsuit filed in the state of New York where 12 nurses have pled that. I personally was contacted by one of the largest virtual nursing services in the United States by a group of nurses of over 50 nurses who all lost their jobs due to recent changes on virtual nursing. We know that AI is coming to transform the nursing workforce in major ways. The reality is that we must be discussing this, because when nursing is simply a cost, we cut costs. When AI becomes a reimbursable tool, we'll purchase more AI than we will fund nursing. And the next time that a chief nursing officer goes into a hospital system and says, I simply need more nurses, they're going to be told, I know you would love more nurses, but I can give you these 3 AI tools instead because we can reimburse for them. And in this situation, when AI becomes a system to make profit in the place of healthcare, patients are the ones who lose. Now, the reality is I am very much a believer of innovation. My entire career has been built, as Peter and I has known, around innovation and entrepreneurship and elevating the nursing workforce in the United States and globally so that they can transform the future of healthcare. Because when nurses innovate, they do so not to make money, but to transform healthcare for the better. And I have seen the best of my colleagues when they go out to solve these issues. What am I witnessing at this moment in time is in a runaway period of time in which we are arguing that AI can make the world better, when we ourselves have not even been able to assess if that AI actually can do the jobs in which we're portraying it to do. So what I would say to each of you is that as a nurse, wherever you start is not where you have to finish. And many of these things that happen in your career often will require you to take very big risk. And you have to determine your voice, your narrative, what you are going to stand for. And ultimately, at the end of the day, when you look in the mirror, can you rectify what matters to you and what you're going to say or not say? And I think for me, I knew personally that the truth is the future of nursing needs many more of us questioning what is going on, speaking up and speaking out, being public on national narratives, and pushing back, because at the end of the day, I truly believe it is only going to be the nursing profession who comes to defend the patient and the future of healthcare in the name of profit over patients. And I would say strongly to each of you as nurses, do not hold back. Start speaking out on social. Question what is happening, question the status quo, as Tracy said, and make sure that our voices are not lost, because the future of healthcare at this moment in time is absolutely absent of many nursing voices, and we need significantly more to shape a better future. Rajendra.
Thank you, Rebecca. And I love you came last but not the least. I mean, the CTA is for us very clear. And, over the years, you and I worked together, Peter and I and Dr. Dilip, of course. What worries me is, when we host these sessions, a lot of people give evasive answers. There was a session we hosted and someone from Columbia University asked, do you know what skills I need? And the chief people transformation officer said, probably I don't know. But I would share with all of you a paper. I created the functional AI pyramid based on the functional integration of AI as it progresses. And what worries me and what bothers me is we have 3 years, not a decade, when AI will impact us. I mean, that's a detailed paper of 25 pages I'm going to share with you all. And we have to prepare people for it. See, once you don't know it, we are going to be trampled upon. But if we know it, we can prepare, work with our systems, carve a journey. And I think today on this frame, we actually have the whole world of nursing. Whole world of nursing. I really mean it what I say this. You have the president of credentialing organization, you have the president of ICN, we have leaders like you, we have Dr. Dilip, we have Cherishti. I mean, we have all the people. So I think we cannot be just talking academic things. I think all of you have brought in interventions which mean nurses will be critical to healthcare, but they are also getting critical. I think we have to discuss how we upgrade them, retain them, and standardize the care delivery with them being at the center. I find it every time, if you read our reports, we have given honestly least importance to them, where without them you cannot run healthcare. But I think the kind of perspective you brought in, we have to discuss things. And I would propose, before we jump into the questions of the people, is that we should look at, and take it to the level of UN. My colleague Peter also is a part of ICONGO, and I think Dr. Jose Cherishti, Dr. Dilip, and you all, we should create a framework for nursing of the future, and let every system sign off that. You cannot lay them off. I keep telling my government, you're building beds and not taking care of nurses. There is no beds going to function without nurses. But if some tech vendors come and say, here is an AI, a nurse AI, I think we are killing our ethics, not the ethical AI. That shouldn't happen. So I think we should all get together to solve this. Otherwise, tech companies have their own way of techno dictatorship. Let's not make that a reality. We should get human, technology, a humane technology, not just technology without human. I think that's something we all have a responsibility, given the positions we sit, given the knowledge we have, and given the work we did. You and I worked on creating, I was surprised what we created. It didn't look like a virtual thing. I was like shocked, but it also tells us we all have a bigger responsibility. But let me come to you because what we are doing is monitoring question. I'm going to ask you question on. So I will start with what I see in the frame first. I'm just going to go randomly, like what kind of timelines you see when nurses would hit full digital transformation? So AI is a part of digital transformation. It's not besides it, it's a part. So I'll start with what I see from Dr. Dilip. I see you as first on my screen, so I'm going to put you on the spot. How many years you think, in your view, nurses will let, this will be hit by this individually? And you know that the worlds are in different stages. Some parts of the world are still in 18th century. Some are already at par with the developments that are going on. So Dr. Dilip, first to you.
I think the definitely for numbers what we have in India, the large number to take this message to all the nursing professionals working in India is going to be a huge task. So at least the beginning we have done today by launching this course, online course. I know one of the challenge what we have in India is any course you develop, it's difficult to reach out to the people, because therefore our nursing professionals, they don't want to leave the job and take the course. So therefore I think Indian Nursing Council, even the whatever the nurse practitioner program what we created, we have created a residency format, so that while working itself they'll be able to acquire the competencies, and the capacity building of that institution also will take place. So therefore I think for India, I think it's a beginning we have done, but definitely it will take long time. I think we need a lot of investment. I think that's why I always tell our zone report is so the strategic direction for nursing and midwifery 21-25, what the WHO is telling to the countries. I think the big investment is required, and that's going to be a big challenge. And so therefore I think we have to continue. At least we have started, and this message should go on. Not one institution is not going to sufficient. We need more. We need more to see that, to reach out. And again, we have to work with the institutions, because how they can adapt in their own clinical setting. So that's going to be a big challenge. So we have to not only educate the nursing professionals, we have to educate the corporate sector, and we have to educate the managers, because they are the people ultimately, even the government also. So therefore it's a big challenge. Definitely at least AI in India, I think many of the experts are already projecting whatever the West is having the AI. I think within 1 or 2 years India can achieve. That is the some sort of projection which I am hearing in the experts' opinion. But even that capacity is there. But to reach out to our nursing professional is going to be a challenge.
Thank you. Dr. Cherishti?
I agree with all of the comments that he noted, and note that in the US, just being a smaller population of nurses and smaller population overall, has potential to move more quickly because of numbers. The thing that I would note and say is that I think we're going to see that digital technology and AI will begin to seep in spaces and places of our personal and professional lives, and already are, at a much faster pace than digital tools have in the past. And I think there's good in that we get familiar with it in our personal use and can translate some of that trust and that usability and familiarity with it, then maybe in our more in our professional lives. And I do think there's great advantages to some of the things that are allowing routine administrative tasks, including nursing documentation, to move into the background. So as I think about the ambient technology that's on the market today, for example, I'm really inspired and excited about a world where nurses can be in conversation with patients, be hands-on with patients, and through that conversation and through providing that care, the technology is capturing the documentation and filing that documentation in an longitudinal electronic health record that includes the patient's first-person voice. It includes all of the assessment information that the nurse is gathering during that care that's being provided, and that can all seamlessly be moved into the background, where nurses no longer have to have fingers on keyboards and eyes on screens, but instead they can have hands on and with patients, and eyes to eye with patients in conversation. So I think there's really great opportunity. And I think once we are able to introduce this type of technology to both patients and nurses and other care team members, that it will be very hard to have them go back to turning their back towards patients to put their fingers on keyboards and eyes back on screens to do things like documentation, for example.
Thank you. Dr. Jose? You're on mute. Dr. Jose, you're on mute.
Yeah, I'm sorry. So I said that I think Dr. Dilip said one thing that is very important, this investment. The investment is very important to analyze how we can improve all things that we need as a nurse. I have some examples because during, for example, the COVID pandemic, a lot of people said, how many years, how many months, how many weeks do you need to learn or to teach to all nurses to use PPE or to implement the vaccination? And everybody have very quick all solutions on the table and for the health systems. Why? Because nurses are prepared. So what we need? We need investment from the governments. If we have investment and they believe as very good professionals, I think it's very quick to implement all things that we want, because nurses understand that if this is important for the patient, we have the opportunity for ongoing training, continuing education. I think that nurses are the first professional in the health system that provide their own ongoing training, continuing education. They use the own time, maybe free time in the afternoon, in the evening, to learn what is the solutions for our patients. So I think it's important that the government believe in that and invest in that. If that is true, so I think the time to implement all things that we can or we need to transform the health systems, it's easier for us, but it's necessary money. Sometimes we use not very well the money in the health systems. And I think that is the problem. It's not from us as health professionals. I think it's the organization, and what is the leaders to provide this transformation in the health systems. Thank you.
Dr. Jose, I think under your exemplary leadership, when we all meet in Taipei next year, we should have a panel on this very important topic, because we cannot push this under the carpet. It's about half of health workforce and 90% of healthcare delivery. We should not count them just as half of health force. They spend maximum time with the patient. Our report is coming out, where patients, doctors, and healthcare CEOs say nurses play a critical role in healthcare delivery. Every single stakeholder is saying that. I think it's time for us to discuss what Rebecca has said, what Charity has said, what Peter has said, what Dr. Dilip has said. We should have a frank discussion on the way forward. That's a very important point to have. Dr. Peter, sorry, I'm very excited about what's going on. Over to you.
Yeah, no, this is great. I think one, I'm concerned about how AI, artificial intelligence, is getting groomed. And right now, it knows medical terminology, doesn't understand nursing terminology. So we have a global program that of advisors that we put together. ICN is involved, NANDA International, Inca, which it's called now. Jing Wang, who Rebecca Love mentioned earlier, is on this. Max Topaz. So there's AI experts. There's nurse informaticists. And I think it's really important because right now, documentation in many parts of the world really is focused on medical practice. And it doesn't focus on nursing practice. And this is some of the work that Rebecca is doing. So I think that's really critically important. As I was looking at the questions that were coming up from the audience, a lot of them said, what do I do? What kind of skills do I need in this digital age? And I really believe it. And Charisti mentioned this beautifully before. There was a report that came out of the World Economic Forum that talked about human-centered skills. Those can't be replaced by AI or technology. So creativity and problem solving, emotional intelligence for self-awareness, resilience, flexibility, lifelong learning and growth. She talked about curiosity, lifelong learning, teaching, mentoring, coaching, and then collaboration and communication skills, empathy, active listening, leadership, social influence. These are the kinds of skills that will be critically important for the future of nursing. So I just want to say that, yes, it's coming. I think ambient listening is going to help us. It's going to enable us to rise to a new level of capability so that we're not so torn down into the technical, but as Charisti was saying before, as really organizers and managers of systems and of care. So I'm excited about it. But I also think that we have to be on top of it, as Rebecca was saying earlier, or else it'll get past us. Over.
Rebecca?
I think this is brilliant, and I think, what, if I'm listening to everyone who's reaching out, just start engaging with AI. It actually is not complicated. It's just prompting, and which means you're having a conversation, and nurses are very good with this. I think there is some things, though, that we should be looking at very strategically and very important, which is the language that nurses don't understand, which is we're never taught business strategy operations, but we're not being taught the technical angles of what this means. So if we're going into ambient listening, which I think we all know charting has just burned us out, which is a wonderful thing. But the reason they're moving into ambient listening of nursing is, to Peter's point, that nursing knowledge was never written down and discussed because it's not reimbursable. And we do charting for the EMR so that we can reimburse for the services that are delivered. Since physician-based work and PT, OT are the only ones that are reimbursable, their charting and language mattered. So when AI started to be made in healthcare, it would work to a certain perspective because AI is built on what's referred to as large language models, which is written word. Written word, nursing was never taken down. So all of these devices were rolled out across healthcare, and they looked really, really good because and when you looked at it and compared it to AI written language or large language models, it looked like it hit all of the medical scoring brilliantly. But when it went into practice, it failed miserably because it was absent of all nursing knowledge. So the reason ambient is moving forward for nursing is because they recognize that all of nursing knowledge is missing. It was bundled into room rates. So now they have to capture all of that knowledge, all of that language, not giving any credit to the nurses who are dumping all of that knowledge into the LLMs and turning that into transformable and actionable data. Large language models only work at this date based on written word. Every conversation you have with AI needs to be 100% transcribed into a written word so that the AI can engage with that data and then transmit it back. Nurses are not aware that even in ambient scribes, it is not 100% factual that the conversation that is transcribed and being happening is what is put in the digital record. And in fact, that digital note is only on average 30 to 40% of that conversation that happened as it is being interpreted by the AI to determine what was the outcome of that conversation. The question of what information should patients and nurses have access to, or physicians, is one that is up for debate. Because if you are not recording the whole conversation, should you have to maintain that recorded call for how long? Right now, the average AI company is not keeping that phone call or that recorded conversation, the actual conversation, for more than 15 days. The transcript, how long should that 100% transcript of that real conversation be held for? That is a printed document. That should be something that every patient, in my opinion, has the right to, as well as every clinician. What was the actual tool and algorithms used to take that transcript and say, this is the right interpretation of that material that is now becoming part of the medical record? And who has the right to sign off on it? Nurses across the United States on social media have actually been sounding the alarm that the notes that they're writing and are being put into the charts are not matching their assessment. Patients are saying, I never agreed to that in that note. Who has the right to it? So the whole question is, we are facing a very large lawsuit in the United States right now regarding one of the ambient scribes over consent and who has access to that information and how long does that information need to be held and who has access to it. So I think that there's huge amounts of opportunity, but with that comes questions of privacy, accuracy, and accountability and access to that information, that we can't just say, hey, nurses, you got to just adopt this technology because you're going to get time back to do these things. But they need to understand how that is being made and what that means to them, patients, and largely the accountability for that. And that is the knowledge that we need to be teaching our nurses. The critical thinking questions they should be asking of vendors and of their leadership when they're rolling out these new technologies.
Thank you so much, Rebecca. I know that this is such a discussion I would not like to end. That's why we called it a live discussion. And when leaders like you all come on screen, it is not about 90 minutes. It's about the future. And I think as leaders, we are going to come back to you because we couldn't accommodate 3,500 because it capped the limit of 500. But I see LinkedIn people have joined. We're going to run a study with all of them, come back as to what they think. We need to create a charter about what's the future of nursing. And we got to do it with them. I think a larger number. So we're going to put this entire video on YouTube for people who couldn't watch. Send them a link to watch it so that they have their views. Send it back to us. We're going to come back to you, and we look forward to creating what will ensure a human-centered, nurse-driven healthcare system. Thank you all so much. Thank you.
Thank you.
Thanks, everybody.
Thank you.
Thank
Bye-bye.
you.
Thank you so much. Thank you all for joining.
Thank you very
And
much.
everybody will receive their official certificate of participation on their email IDs in the next few days. Thank you so much again. Thank you.
Bye.